Now, circle this date, the 1st of July, the year 2024. Why? Because Kenyans will start contributing to the Social Health Insurance Fund. Now, this follows the completion of the public participation exercise and validation of the regulations that are set to be presented to Parliament for adaptation. This comes as the registration process will kick off in March. County governments have since demanded more representation in that decision-making process as the county shifts from National Hospital Insurance Fund, or NHIF, as commonly known, to the SHIF. Nancy Okware with the details of that report.
Monday at the Kenyatta International Convention Center, health stakeholders gathered for the National Validation Workshop on the Social Health Insurance Fund regulations. The regulations, among others, spelled out how the registration process will be conducted before the 30th of June 2024 to facilitate the start of payments to the fund from the 1st of July 2024. In the regulations, those in polygamous unions will be required to cough out more for their spouses.
My most favorite one was the one where men were asking if they have more than one wife. If I was allowed to respond as a wife, I would say no to the others. But as the Cabinet Secretary for Health, and we are saying we want to leave no one behind, we are going to take care of all households as requested by the feedback from the public.
Where a contributor has an additional spouse, the contributor shall make an additional monthly or annual premium equal to the contributor's monthly or annual contribution for each of the additional spouse.
Additionally, a person who attains the age of 25 years and has no source of income or is living with a contributor to the fund will be treated as a household separate from the contributor and will be required to pay 300 shillings a month to the kitty. If approved by Parliament, salaried people will be deducted 2.75% of their gross salary by the 9th day of each month.
The solutions that we have that were proposed through this legislation, which we're going to be implementing, I think are conceptually sound. I think they are ideologically aligned with and coherent with the aspirational goal that we have of universal health coverage. And under my leadership and together with the SHIF board, we can give you commitment that the execution is going to be disciplined.
These regulations, ladies and gentlemen, provide detailed and comprehensive guidelines on how the primary health care fund will operate and the benefit packages within the primary health care system. And again, the packages include preventative care, maternal and child health services, immunizations, chronic disease management, eye, ear, and dental care services, and mental health support.
The Social Health Insurance Act aims to ensure inclusivity by extending healthcare coverage to the entire population. It also promotes equity by implementing a fair and sustainable financing model based on social health insurance principles.
Stakeholders have, however, urged the Minister of Health to ensure remittance to hospitals is timely to curb delays such as those witnessed in NHIF that is now being phased out. Meanwhile, the Council of Governors is calling for more involvement in the transition process from NHIF to SHIF.
Effective operation of the Social Health Insurance Act requires all our cooperation. On this note, let me urge the Ministry of Health to always ensure consultations and concurrence of the Council of Governors and county governments, as well as move forward with the social health insurance mechanism.
The Ministry of Health is confident that the availability of a proper legal framework will propel Kenya towards the attainment of universal health coverage that has remained elusive for years. Nancy Okware, reporting from the Kenyatta International Convention Center, Nairobi.